Welcome to Snackable Health. Doctors Kohli and Gibson, and we're talking about today's big news about the emergency use authorization for a Pfizer vaccination or booster, rather, in those children aged 5 to 11. What do we know, Pyle?
Mike, we just heard this morning from the FDA that they are endorsing at least 5 months after the initial two-dose vaccine with Pfizer for kids 5 through 11 to get this booster. Now, this is an interesting scientific thing because these kids, as we know, are not as high risk for getting critically ill with infection, particularly with the Omicron variant. But I think it's really a testament to a few different things. One is that we know that the immunity is going down, and kids are a big part of spreading the infection. So that's part of why we want to boost our kids. But second, and importantly, I think, is this long COVID. As we're seeing with Omicron, about 1 in 3 people are developing long COVID after infection, and kids are certainly part of that demographic. So the hope here is that by preventing infection or at least boosting kids' immune systems, we could potentially reduce the incidence of long COVID.
And where are we for kids under 5?
That's the question I keep asking because I have a nephew who's, 4 years old. And when that vaccine is going to come out still is a bit of a question mark. Now, the FDA is meeting in early June to review that data. But really, my question has been why so long? Because that's the population that's been left behind at this point. Besides that age group, everybody else is eligible to get a vaccine. So I'm really hopeful that whatever extra data they were waiting on does come through and that it does get EUA when the FDA meets in early June.
There's still a lot of questions out there about how long are we going to need boosters? Are we going to need them every 6 months? Are we going to need them every year? Or are we going to end up with wearing out our immune system with all these boosters? Still a lot of questions out there. But thanks for the update today, Pyle, and thanks for joining us here at Snackable Health.